So let's first talk about what implantation is. So implantation is when an embryo, aka your fertilized egg, attaches successfully to your endometrial lining. If it is an implantation failure, this is when this is not done successfully. And so the goal through food is to make sure you can thicken your uterine lining to make it nice and thick and also receptive so you can implant the embryo successfully. So let's talk about different types of ways you can test for implantation failure. So you can do a hysteroscopy, an ultrasound, or you can just assess your hormone levels through a blood test. This is really important because if it's like low progesterone, for example, which is really common because progesterone helps thicken uterine lining and helps the implantation. So if this hormone's low, that could be a big contributor as to why you're struggling with implantation. And testing aside, there are actually three main factors that go into having problems with implantation. And the first one is going to be the quality and chromosomal status of your embryo, which can greatly influence its ability to actually implant successfully in your uterine lining. So what I would do is make sure that you're supporting your egg quality and to make sure he is supporting his swimmer quality, because an embryo is combining both of these. Number two is your uterine linings. There are actually certain elements that can reduce the receptivity of your endometrium, aka your uterine lining. So one is a thin uterine lining. So I actually put a post up earlier this week about turmeric because yes, it's a really great antioxidant and can help reduce inflammation, but there's actually been research showing that actually can thin your uterine lining even more if you already struggle with a thin uterine lining. So if you're consuming supplements that have over like 700 milligrams of turmeric and you're consuming them every single day, you may want to make sure that you are avoiding that and just doing culinary doses. But yes, a thin uterine lining can actually impact implantation. If you have polyps or if you have fibroids, maybe if you have a malformation like a T-shaped uterus or any endometrial infections or even uterine peristalsis can also really harm implantation. And the third factor for implantation failure is going to be systematic conditions that are actually unrelated to reproduction, but they really can harm fertility. So that's immune system disorders, also thrombophilias. This is when there's abnormality of blood coagulation that can make blood clots more likely to form. And so if you have any questions about implantation failure, implantation in general, definitely drop them in the comments below and I will make sure to answer them. Please share this video with someone who is struggling with their fertility and make sure to save.